The urgent need to find a bathroom, frequent diarrhea, distressing abdominal pain. Does this sound like you or someone you love? It could be irritable bowel syndrome with diarrhea, a condition that affects as many as 16 million Americans. So how do you know if you have IBS-D? And what can sufferers do about finding some relief? These are just a few of the questions we'll ask this morning. I'm Erica Petrini. Access Health starts now. Irritable bowel syndrome with diarrhea, IBS-D, is a common disorder of the large intestine. Symptoms can happen on a regular basis and can vary widely from person to person, but often include abdominal pain and diarrhea, loose or watery stools, and/or frequent bowel movements. IBS-D has a significant emotional impact on sufferers because hard-to-predict symptoms tend to cause embarrassment and a lot of time spent in the bathroom. Thanks to updated diagnosis criteria and different treatments now available, the road to relief doesn't have to be long. Let's meet two women who have struggled with IBS-D for years, Desiree Guarino and Ashley Walkley. Their stories are unique, but they both hope to help other sufferers find relief sooner by talking with us today.
I'm Desiree Guarino. I live in Southern California, and I'm 36 years old. I can remember feeling symptoms of abdominal pain and diarrhea as early as 10 years old. As a kid, when you're growing up with this and you have to get a hall pass to go to the bathroom, but you have diarrhea, it's a lot of hall passes. It's very embarrassing. The hardest part for me was high school. I was scared to eat lunch. I was afraid that I'd have to run to the bathroom right after eating. I was afraid to go out with my friends. I had to miss out on a lot of social events growing up. These symptoms really started to shape who I was. As a kid, I was young and free and adventurous and free-spirited. And then as I started to have these symptoms, I started to become worrisome and became fearful of my symptoms, so it almost started to become who I was. Instead of living this free life, I was living under restriction because of what I couldn't do. In college, I studied film and TV, and we learned about the actual production life, which is 12 to 15-hour days, and you're on set, and you're eating foods that are brought in by the crew. So my dream was to move out to LA and pursue production and have a freelance production career, and I put that dream on hold. My symptoms wouldn't allow me to do that. I couldn't be on set for 12 hours not knowing where a bathroom was. I couldn't eat food that I didn't have control over, and I just couldn't live that freelance lifestyle. So I settled. And I did a job that was more routine, and I did that for the better part of my 20s and kind of gave up on that career, and I let my symptoms pretty much rule my life.
My name is Ashley Walkley. I'm 35 years old, and I live in Hermosa Beach, California. I started having symptoms of IBS-D when I was 27. It's been a long road. It all started with severe abdominal pain, and then a few months later, the frequent and unpredictable bowel movements began. I've always been an extrovert, super involved in working out, networking events, going fun places, and traveling. IBS-D changed that. I was leaving work early, coming in late, and always rushing to be home to lie down and be comfortable in my own space with my own bathroom. It really affected my life in so many ways. I used to joke with my girlfriends that I literally knew every restroom on my hour and 10-minute commute to work every day, and having to figure out if I could have coffee in the car or not, because sometimes that would create an unpredictable bowel movement. I mean, mornings tended to be the worst for me. And I really had to assess how I was gonna get to and from work, especially when there was traffic. I think part of it too is I had a pretty demanding job in marketing and communications, and I worked a number of events with little to no access to restrooms. You almost become embarrassed about the day-to-day ways that you operate. From the time that you wake up, from the time that you go to bed, you're constantly just thinking about your stomach, your food, and the bathroom. It's all consuming and really it's embarrassing. I gave up all of my non-work related activities and had to stop training, running, and working out. I didn't want to be in any social situations. Everything in my life was affected. Friends, family, relationships, vacations, travels, meal choices and planning, always needing to be prepared to know what food options were available and where the nearest restroom was just in case. It took me 5 years to get diagnosed with IBS-D. And throughout that entire process, I felt like I was on a dark road to nowhere. I was left feeling hopeless when I wasn't being treated and diagnosed properly. Thankfully now, I'm on the right path.
As we've learned from Desiree and Ashley, the symptoms of IBS-D can have a significant impact on people's lives. We'll sit down with IBS-D expert Dr. Mark Pimentel when we return. Stay with us.
By 2014, I was at rock bottom. That's when I was referred into Dr. Pimentel, who finally helped give me some real answers and find some relief.
Welcome back. Today we're talking about irritable bowel syndrome with diarrhea, also known as IBS-D, and the symptoms and the struggles of living with this condition. Earlier we heard from patients Desiree Guarino and Ashley Walkley about what it's like to live with IBS-D. Now we'll talk to a leading expert in the field and Ashley's doctor to give us more background about the condition, how it's diagnosed, and how it's treated. Here's Dr. Mark Pimentel, director of the GI Motility Program and Laboratory at Cedars-Sinai Medical Center.
The impact IBS-D has on patients' lives is incredible. They have symptoms that come at any moment and can interrupt the social engagement, travel, even the family dynamic, leaving the patient embarrassed by the whole situation. I hear this from many of my patients, including Ashley, whose IBS-D I've been treating for the past 3 years or so. IBS-D is relatively easy to diagnose based on symptoms alone, which makes Ashley's case so frustrating to me. Here's what I look for, and the symptoms viewers at home should relate to their healthcare professional. Complaints of abdominal pain and diarrhea are bundled together. Specifically, abdominal pain associated with bowel movements at least 1 day per week for the last 3 months, and a change in the frequency or form of the bowel movements. This helps distinguish between IBS with diarrhea and 2 other main types of IBS, IBS with constipation and IBS with mixed symptoms of constipation and diarrhea. This is important because the treatments are somewhat different for the 3 types. Patients with irritable bowel syndrome with diarrhea have a number of symptoms, and so there isn't a one-size-fits-all. But diarrhea must be part of the picture, and pain is often part of the picture. Also, when the diarrhea hits, often it's preceded by pain. So let's say you've had a meal and it's triggering an event. You're often doubled over in pain and then suddenly need to go to the bathroom and have diarrhea. And the cramping can go on for minutes or even up to a half an hour. So it can be very difficult for patients to, for example, go to a meeting and be suffering through the pain because the pain is so intense, or be at a dinner and sit at the table and continue to eat despite that pain. Healthcare professionals also check for the following features often described as alarm features, such as symptom onset after age 50, severe or progressively worsening symptoms, unexplained weight loss, nighttime diarrhea, rectal bleeding, iron deficiency anemia, or a family history of colon cancer, celiac disease, or inflammatory bowel disease. If any of these alarm features are present, the patient should be referred to a gastroenterologist for further diagnostic testing. But in most cases, if you're experiencing abdominal pain and diarrhea without alarm features, I feel IBS-D diagnoses and treatment recommendations can be made early on by your healthcare professional. If you're experiencing IBS-D symptoms, it's important for you to speak openly and honestly about them with your doctor, so he or she can make a confident diagnosis and identify the treatment that's right for you. There's no need to be embarrassed.
As Dr. Mark Pimentel discussed, diagnosing IBS-D should be based on symptoms, not tests. Now let's hear more from Desiree and Ashley about their experiences and what treatments they tried before finally finding relief.
In college, it got worse. I couldn't go anywhere without being the driver. I had to always have an escape route. So for social events, there were a ton of them that I just basically missed. I didn't go, I didn't participate in because I couldn't have my way out. I was missing class a lot, and college is a time where you really have to prove yourself, and there were a lot of classes that I just didn't end up attending, and a lot of events that I didn't go to. In my 20s, I feel like I tried everything to get rid of my symptoms. I tried every diet that was out there: paleo, vegan, raw, FODMAPs, you name it. Nothing was helping. I tried every test I could take. I went to see numerous doctors. I didn't give up. I just kept looking for a way to solve this, and nothing seemed to work.
In patients with IBS with diarrhea, diet can be important. Certainly, as patients try to help themselves, they often try numerous types of diets, dairy-free diets, gluten-free diets, but still the symptoms remain and they still end up seeing a physician.
After seeing a number of different doctors, I still struggled with severe abdominal pain and unpredictable diarrhea at times. About a year into my symptoms, I went to see a gastroenterologist who scheduled an endoscopy, a colonoscopy, and a CT scan, but I still wasn't diagnosed with IBS-D. I tried numerous dietary changes: no dairy, no gluten, you name it. I tried multiple prescription and holistic medications, but I still didn't feel better. I was always in pain, and the bowel movements continued to be unpredictable. This trial and error went on for over 5 years. It was a really hard chapter in my life. IBS-D is a silent disease and has a social stigma to it that a lot of people aren't willing to understand. By 2014, I was at rock bottom. That's when I was referred into Dr. Pimentel, who finally helped give me some real answers and find some relief.
Coming up, Desiree and Ashley discuss how they finally found the relief they were searching for. Stay with us. Welcome back to our discussion on IBS-D, Irritable Bowel Syndrome with diarrhea, a condition affecting millions of Americans. Let's go back to Dr. Mark Pimentel to learn about an exciting treatment option that may help adults break free from IBS-D symptoms.
Years of searching for a diagnosis and relief certainly does not have to be the norm. Diagnostic criteria have evolved, and IBS-D treatments have made great strides. One medication I feel strongly about is Xifaxan 550 milligram tablets. Xifaxan is indicated for the treatment of irritable bowel syndrome with diarrhea, IBS-D, in adults. And it's actually the #1 medication for IBS-D prescribed by primary care physicians and gastroenterologists. I see patients like Ashley who have chronic abdominal pain and diarrhea bundled together. I prescribe Xifaxan first line. In clinical trials, Xifaxan significantly improves IBS-D, abdominal pain, and diarrhea. What we've seen in clinical trials is that a 2-week course of Xifaxan provided significant symptom relief for up to 6 months. That's welcome news for IBS-D sufferers. If necessary, patients can be retreated with Xifaxan up to 2 times if symptoms return. And I've had patients who have only needed 1 2-week treatment of Xifaxan. For the patient who improves and then relapses 3 months later, retreatment often provides additional benefit.
Xifaxan is not for everyone. Do not take Xifaxan if you have a known hypersensitivity to rifaximin, any of the rifamycin antimicrobial agents, or any of the components in Xifaxan. In clinical studies, the most common side effects of Xifaxan in IBS-D were nausea, feeling sick to your stomach, and an increase in liver enzymes. If you take antibiotics like Xifaxan, you could experience diarrhea caused by an overgrowth of the bacteria. This is called C. difficile, or C. diff for short, and a healthcare professional should be contacted right away if diarrhea does not improve or worsens.
The first medication I was prescribed was Xifaxan. All of my symptoms were gone: no abdominal pain, no diarrhea. I felt like I could finally live the life I always wanted. I could go on set and partake in different TV shoots. Like, I started to actually become that free-spirited person that I was when I was a little kid.
Xifaxan manages my symptoms of abdominal pain and diarrhea, and the 2-week dosing doesn't interfere with my life. I'm not taking any other medication. Xifaxan is so much more manageable than a lot of the other treatment options I've tried over the years. I love what Xifaxan's done for me.
Xifaxan is dosed differently. It's not a chronic therapy that needs to be taken every day for a long time. For adult patients with IBS-D, the specific dosing of Xifaxan is 1 tablet that you take 3 times a day for 2 weeks with or without food. It's important for patients to complete the entire course of treatment, even if they begin to feel better before they've finished it. If necessary, patients can be retreated with Xifaxan up to 2 times if symptoms return. Xifaxan was well tolerated across clinical trials, and I've seen the same low rates of side effects with my patients. In clinical trials, the most common side effects of Xifaxan in IBS-D were nausea, feeling sick to your stomach, and an increase in liver enzymes. Xifaxan also has a low incidence of constipation. Patients should not use Xifaxan if they have severe liver impairment or if they are pregnant, planning to become pregnant, or nursing.
I want to make sure other people suffering from abdominal pain and diarrhea know that it could be IBS-D and that they should talk to their doctor.
We've had a great discussion about IBS-D today. We met Dr. Mark Pimentel, director of the GI Motility Program and Laboratory at Cedars-Sinai Medical Center, who covered the typical symptoms of the condition, how it can be diagnosed, and the success he's seen firsthand with Xifaxan. We also heard from Desiree Guarino and Ashley Walkley, IBS-D patients who hope their stories will help anyone watching that is suffering from IBS-D-related abdominal pain and diarrhea.
Since meeting Dr. Pimentel and starting treatment with Xifaxan, I feel like I've gotten my life back. Before Xifaxan, I was taking a lot of different medications for so many years. It's liberating to not have to deal with any of that other stuff. I feel free. My life would be so different if my first doctor had just diagnosed me and prescribed Xifaxan. Since that didn't happen, I want to make sure other people suffering from abdominal pain and diarrhea know that it could be IBS-D and that they should talk to their doctor.
My advice to anyone watching who thinks they may have IBS-D is to be your own advocate. Tell your doctor about your symptoms and ask if Xifaxan could be right for you. You don't have to wait to see a gastroenterologist.
Diagnosis and treatment for IBS-D starts with a conversation between you and your doctor.
Irritable bowel syndrome with diarrhea can be an uncomfortable subject to discuss. However, it's an important one to discuss, especially with your doctor. I'd like to thank all of my guests for their insights and personal stories today. For more information on the IBS-D treatment option discussed, visit Xifaxan.com. And of course, you can log on to our website at accesshealth.tv. We'll see you next time.
Indication: Xifaxan, Rifampicin, 550 milligram tablets are indicated for the treatment of irritable bowel syndrome with diarrhea, IBS-D in adults. Important safety information: Xifaxan is not for everyone. Do not take Xifaxan if you have a known hypersensitivity to rifaximin, any of the rifamycin antimicrobial agents, or any of the components in Xifaxan. If you take antibiotics like Xifaxan, there is a chance you could experience diarrhea caused by an overgrowth of bacteria C. difficile. This can cause symptoms ranging in severity from mild diarrhea to life-threatening colitis. Contact your healthcare provider if your diarrhea does not improve or worsens. Talk to your healthcare provider before taking Xifaxan if you have severe hepatic liver impairment, as this may cause increased effects of the medicine. Tell your healthcare provider if you are taking drugs called P-glycoprotein inhibitors, such as cyclosporine, because using these drugs with Xifaxan may lead to an increase in the amount of Xifaxan absorbed by your body. If you are pregnant, planning to become pregnant, or nursing, talk to your healthcare provider before taking Xifaxan, because Xifaxan may cause harm to an unborn baby or nursing infant. In clinical studies, the most common side effects of Xifaxan and IBS-D were nausea, feeling sick to your stomach, and an increase in liver enzymes.